Welcome to Community Conversations. I'm your host, KK Kaneshiro. The Fremont Unified School District has teamed up with the Tri-City Health Center and a very impressive group of sponsors to present the second annual Ohana Health Fair. This event will take place Saturday, May 30th at Washington High School in Fremont and will be a great way for the community to discover and learn more about the resources available to help live a healthy lifestyle. With us today to talk about this fair is the Fremont Unified School District Coordinator of Health Services, Ms. Cheryl Knight, and representing the Tri-City Health Center's CEO, Dr. Zeddy Page, as well as Joe DeLay and Will Lacros. Thank you so much for being here. And of course, my favorite co-host, Dr. Jim Morris. Now, I got to start off because this is the second annual Ohana Health Fair. How did this all come about? Whose brainchild was this? And why? What's the purpose of it?
Well, this started about 2 years ago when one of our planning and development specialists, Joe DeLay, who actually engaged the community about things that we can do. And he came up with that wonderful idea of Ohana, Hawaiian, of course,
family.
Meaning family, trying to figure out some things to do as a family component within the school system. So they got together with the school, and I believe that's how it was originated. So
Okay, so the first year was also at a school as well?
Yes, it was.
Okay, so because of the partnership with the school district, that's why it's in the school. Because most people are asking me, why is it at a school and not a hotel or a typical health fair venue? I love this idea because the families are already there.
Absolutely.
Right? Right. So what kind of vendors or health practitioners can these families expect to meet?
Well, last year we had over 35 vendors, and Joe's been very active in helping to recruit and to kind of talk this up. And I believe this year, as of now, we have over 50 people signed up, 50 vendors signed up.
Wow.
So there's going to be a lot of family engagement. There's
Okay.
going to be some activities, hula, ukulele, just a number of things
How
that
fun
we're
is that?
just looking forward to getting engaged and involving. And of course, the theme of this is connecting people to our partners and of course Tri-City Health Center to look at ways that we can improve and engage them in quality health care.
Okay.
And I think what's really cool about the fair, especially this year, it's going to be right out on Fremont Boulevard. And you know, you're not going to be able to drive down Fremont Boulevard on that Saturday without seeing the excitement and the activity. And I think that was, for me, the most touching thing last year was just to see it was families that came. It was people who just, it was a place to ask questions and have their questions answered.
Right.
But it was fun. I mean, the atmosphere was fun and festive. It really was a fair atmosphere.
Absolutely. How many attendees did you have the first one? Can you guesstimate?
It was over 300 within
300,
the
nice.
3-hour time period.
Okay.
This year we're looking at over 500.
Nice. Okay, so I told everyone the date. So it's from what time to what time?
From 10 to 1 p.m.
10 to 1 p.m.
Yes.
Okay. And I know you have vendors, but do you also have the different departments of the Tri-City Health Center there too? So, you know, if this family member has an issue, they can talk to this or this other issue, or how does this work?
Well, some of our departments are going to be represented out there, so we'll have our teen clinic that'll be out there representing their program. Our behavioral health program will be out there. Our vision program will be out there. Our dental program. We'll also have our enabling services outreach team out there talking about our general services overall.
Nice.
Did I miss anything else?
Yeah.
I think that was about it.
Because I think one of the biggest secrets in Fremont is the Tri-City Health Center.
Good point.
I'm serious, because a lot of people don't understand what you do. And when I say, because they think clinic, and I go, it's more than a clinic. You can actually say this is a hospital. They do everything except emergency situations, right?
Yes, we're outpatient based and we provide comprehensive care, and we also, because we're federally qualified, we look at that wraparound piece. That means that how do you enable people to get access?
Right.
And of course we're grounded in youth. We have a pediatrics program that are active in terms of engaging from, we say, from birth all the way through the through the development stages. Very exciting opportunities. We're the only federally qualified health center in Fremont, and we're excited. Dr. Morris has brought some amazing opportunities, and we're looking at partnering and moving forward, wrapping around the other community partners who are actively engaged in providing health services. So the theme is really not leaving any family, any of our communities behind.
Yeah.
We provide that in over 21 languages.
Wow.
So we're actively engaged in understanding and making the cultural component of health relevant to our communities and to actually provide it in the languages that they're best comfortable with.
Okay. Now, one question I got earlier today was, okay, the Tri-City Health Center, how's it different from Washington or Palo Alto? I mean, why would I go to you? What would you say?
Well, I would say that we actually, as a federally qualified health center, we provide affordable services. We utilize a sliding fee scale that provides a match based on the income and the ability to pay, and that is not a barrier to provide health services.
Which is great, because I think that's your shining star, your shining product that you offer. Anyone of any income level can go to the Tri-City Health Center and get whatever care they need, right?
Yes.
In almost 21 languages.
That's right.
Well, and I think the important point Dr. Page makes is you really think about our job as educators. I'm a teacher in a classroom. All I know is here's the standards that I'm supposed to be teaching for my grade level. And yet oftentimes we have children who can't access the curriculum because it is something in one of those enabling components, or they may have a vision problem, or they may have a toothache, or they may have a medical problem. Our job is, as educators, to teach them the standards, but we can't do our job if we don't have those community support services and a place to get help for a child when they really need it.
Right.
And that's really what this fair is about. That's the connection with family. It's a place that a family can go to get answers, to get help, to find resources when they have one of those issues that they don't know how to deal with.
Now, one thing I want to make clear to everyone watching, even though it is at Washington Hospital, this is open to everybody.
At Washington High School.
Washington High School, sorry, my part bad. But it's open to everybody, right?
Absolutely.
Just not the Washingtonian students' body. Okay, good.
Yes.
Now, Cheryl.
Yes.
When Joe and Tri-City Health Center had this great idea, they came to you, and what did you think?
It was the first time I had ever done anything like this last year, and Joe had to teach me a lot of techniques in marketing and that kind of thing, and he is the expert. But I was very excited, and we've been working with Tri-City for the last couple of years, putting dental into our schools, working on getting some vision. They come in and they do a mobile dental.
So you go to the schools?
Yes.
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 How fabulous is that?
Yes.
Oh my
So
gosh, okay.
I work pretty closely with them, and we thought it was a great thing. We had a lot of fun last year. Very excited to do it this year as well. And from the district, we've got student support services that will be there talking about immunizations and enrollment.
Okay.
Their team, and then the school nurse team. There's about 8 of us that will be out there looking at body mass indexes and doing some talking about healthy, lifestyles and that kind of thing. And then child nutrition services will be out as well, talking about appropriate diet choices. So we're excited about being out there as well.
This is great. This is like, okay, I'm dating myself, when the doctor would come to our house. Okay, this is wonderful. I love this. So you actually go to the school campuses. Is there a schedule? So if a parent wants to make sure that little Johnny gets his eyes checked or his teeth, something's wrong with it, and she can make sure that he goes there to when they come on campus, or how does this work? How does the parents know when they...
At this point currently, we have a couple schools that are involved in this. This is a new, at least on the dental piece, this is new for Tri-City coming into the schools. We just started this in February. So they are there 1 to 2 days a week at 2 different campuses, and applications are filled out by parents, so stuff is sent home.
Okay, so they
bring it back in. We have to have consent from parents.
Okay.
And they do the exams and x-rays, and then if they need anything more than that, they'll refer them to the Tri-City Dental Clinic, where they can actually go in and get the additional work.
Okay.
So it's just kind of birthing at this point right now, and the school and the kids are very excited about it. So it's going very well.
Okay. Now, was the health fair at the same time as this year? Same May date? Or is it different?
Last year was in August.
August.
This year we're having it at the end of May.
Okay.
We found in August, because school hadn't started, that I think we lost a lot of people because a lot of staff and that kind of thing were on summer vacation, and we kind of bumped it back this year so that we could
catch them before.
Catch more people, yes.
Yeah.
And you really think, I'm so excited about the location, because it's right out there, corner Fremont Boulevard and Country. You're not going to be able to drive down Fremont Boulevard without seeing the fun and really the opportunity to learn.
Okay,
I mean,
so will it be on the front lawn or at the Tacfadena?
the
Front lawn.
Front lawn.
Yeah.
Nice. You weren't kidding.
We're going to be right on the street, making all kinds of racket.
And having fun and,
Okay.
and teaching people and really drawing the community in to say this is important. I think back to the first time I had a root canal done. and it gave me such a sensitivity as a teacher to, because I'd had this toothache and I didn't really realize, and I went and had this root canal done, and I came out of the endodontist's office. The colors seemed brighter. The air smelled sweeter. Suddenly this pain was gone, and it made me as a teacher realize what students in my classroom who maybe needed dental care or maybe had a vision issue or maybe needed some medical care who didn't have it, how that was stopping me as a human being from doing what I wanted to do and needed to do.
Right.
And that's why this is so important for our children.
I think this is great.
And community.
Yeah.
Absolutely.
Yeah.
Absolutely. And the health education piece is so central to our partnership and the relationship, because
Yeah.
healthy lives is not something that it evolves. You have to learn. You have to actively participate, because it may mean something different once you have various experiences.
Right.
You begin to grow and develop that. So we want to start early with teaching and helping families to understand how to do that.
You know what I love the most about this whole thing is that you're teaching young people not to be afraid of the doctor. The doctor is your friend. The doctor's here to help you. The doctor's here to, educate you when something goes wrong. This is what you need to do, or if you want to live long, you need to start eating more fruits and vegetables, or whatever it is. But you're making them unafraid of the medical world, which I think is phenomenal. Because I'm still afraid.
But what's really nice about the providers, it's a fun atmosphere, and I think that's really the encouragement for parents to take their children. It's fun, and they don't make it just about, this is about medical services and going to the doctor.
Right. I think that's the component that make, like the hula dancers and the ukulele. These are professional dancers that you have, or is it anyone can participate?
We have performers that
Okay.
are coming in, one of which is coming from Oakland. They're the Academy of Hawaiian Arts.
Okay.
They'll be performing. So.
Nice. So, but if a child wants to dance, so of course they can dance.
Yes,
Okay.
definitely.
That's
Or
great.
an adult.
Or an adult. Okay, I'll look for you in your best spirit. No, this is great because I think with that component, it's even less scarier, and all of a sudden you're human now to these kids and adults, maybe. But I think that it makes you separate from the typical health fair, where you just go and you see this doctor or this department, and it's kind of stoic and kind of
It's
boring.
very engaging.
Yes, I like that. I like that. And I also like how everyone in the family is involved, right?
Yes.
Okay. Do the teachers, do they help get the kids out there, get them encouraged to go with their families, or how does this work? Do they get involved?
They're slowly getting involved.
Okay.
We've been doing a lot of like PR at the schools with
Okay.
posters and different things on our websites and that kind of thing
Okay.
too. This is still new, so we're still
Yeah, of course.
in the birthing of that. So
Now, last year, where was it? What school?
Centerville.
Centerville. So every year you're going to rotate it, or how's this working?
Well, we kind of outgrew Centerville pretty quickly.
Okay,
so we were looking
that's
for
why.
a bigger venue.
Okay.
And if Washington is a successful place, because it is right on Fremont Boulevard, we're going to try to keep it at, as long as we don't outgrow Washington, then we will, that'll probably be a better place to be.
What's bigger than Washington? Nothing.
We don't have much. Well, we have the new property on Fremont Boulevard, 34 acres of
No,
field.
that's true. That's just field, though. Yeah. Okay.
But the nice thing is, when we had it at Centerville, it wasn't out on the street. But at Washington, we have such a beautiful front lawn area.
Yes.
And really,
And that
it's-
historic-looking building.
and that historic-looking
Yes.
building, and just getting people who may be driving by or out. There was a car show at Washington High School 2 Saturdays ago, and I was just fascinated at the number of people who were just driving by and they stopped because that's a
Right.
really central location.
Yeah.
And that really, I think, we're really trying to inform the community ahead of
Right.
time, let people know about it, but we're also hopeful that people will just, hey, something's going on at Washington.
Let's stop and look.
stop and see what it is.
Yeah. This is so exciting.
Kiki, you talked a little bit about just the medical piece and the health stuff that's going on out there, but we were actually able to get the Fremont Fire Department's going to bring one of their rigs as long as they don't get a call. And the police department is going to have their 57 Chevy that they use for displays.
That's fun.
We have the Army that's bringing a Humvee.
Wow.
And the Air Force is bringing a trailer that has video games in it that the kids can actually go in. It's a recruiting tool. The kids can go in and play video games. So we are excited.
Okay.
So that lawn's going to be full.
Okay, define kid age. 53?
Okay.
I think we make it.
Okay. Because that sounds like fun.
Isn't that neat?
Yeah. And I like how you got not only our uniform, peace officers and fire department, but also the Air Force and Army.
The recruiters.
This is great.
Yes.
Now, this is a great segue. I just want to wish you the best of luck, because would you like to announce to everyone where you're going for 5 months?
Well, actually, I can't announce it on the air, but
Okay.
I'm deploying with the
Okay.
Air Force Reserves in August for 5
Okay.
months. So, and I'm very excited.
Well, we're excited for you.
Thank you.
You will come back.
I will come back.
Okay, good. Because Joe will be lost.
I know he will be.
Just in time to start planning for
the next
health fair.
So, what else would you like if you had, there was no boundaries, what else would you like to encompass into this health fair for next year? If anyone's out there watching and they say, I want to participate in that, what else would you like to see on your wish list?
I would hope that this is another opportunity to actually extend all services related to health and happiness, the wellness. And we've met a few people over the last few years who we know support and are very interested, and we want to make sure that we can work together to get the timing right, to make sure that we can engage across the board. There's a lot of grandparents who are raising children. We want to make sure that we link them also.
Good point.
I mean, it takes a whole village.
Right.
So we really want to grow that theme, that it includes the entire family concept and the community.
Okay. This has been wonderful to hear about. I thank you so much. I wish you the best of luck, and I can hardly wait till you come back home,
Thank you.
back to us, right?
Yes.
Okay, good. But thank you so much for being here. You guys were great. Thank you,
you for
Dr.
having
Morris.
us.
From everyone here at Community Conversations, we appreciate you watching, and we'll see you next time. Thank you.